A patient comes with a chronic cough, evening rise of temperature, night sweats, and unexplained weight loss. Which disease should immediately come to your mind? Is it asthma, pneumonia, pulmonary tuberculosis, or COPD? Pause and comment your answer before watching further. The correct answer is pulmonary tuberculosis, TB. Why TB? Chronic cough lasting for weeks, evening rise of temperature, low-grade fever, typically worse in evenings, night sweats, a classic red flag symptom, unexplained weight loss. Together, these are the classic constitutional symptoms of TB. Asthma usually causes wheezing and breathlessness, not weight loss, NO night sweats. Pneumonia is an acute condition with high fever and productive cough. COPD causes chronic cough and breathlessness, but not this pattern of evening fever and systemic symptoms. Remember this: chronic cough plus evening fever plus night sweats plus weight loss equals think TB first. Please like, share, comment, and subscribe for more medical learning.